All your favorite products under one roof in Bahrain from our 14 branches at 27-year-old Megamart and Macromart. Bakery, fresh meat and fish, fruits and vegetables, sweets and snacks, ready-to-eat foods, dairy products, grocery or consumer goods. To have a wonderful shopping experience, please visit your nearest Megamart Macromart branch. Megamart and Macromart, full of goodness.
Hello dear friends, good evening. Welcome to the 200th episode of BMC Global Live Al Hilal Health World, nothing but lifestyle. In each episode of this talk show, we bring before you an expert doctor from Al Hilal Hospital to discuss your various health issues. Hearing loss and ear balance problems are a common concern these days. And to discuss about this subject, we have the ENT surgeon from Al Hilal Hospital, Manama Central, Dr. ANNJU THOMAS. So, doctor, welcome to the show and thank you for joining us today.
I am delighted to be here. Thank you for inviting me.
It's a pleasure. So, doctor, what are the common ENT problems that come to your OP these days?
Yes, the most common ENT problems that we see in our OPD, first most would be hearing loss then ear infections like having ear pain, discharge from the ear, then some people present with dizziness, vertigo and tinnitus, that is ringing sensation in the ear. Then I also see cases from the nose like sinusitis, allergy problems, sleep apnea, snoring in the night. Then throat problems like tonsillitis, pharyngitis, voice related issues like hoarseness of voice, and even we see swellings in the head and neck region like diseases of the salivary glands, that is the gland which produces the saliva in our mouth. And even we also take care of and commonly see disorders of the thyroid like swellings or hypothyroid case and hyperthyroid cases. These are most commonly seen in our ENT OPD.
Okay. Now, how prevalent is this hearing loss in the society now?
Okay. As I said, hearing loss is one of the most common issues that we see people suffering from. According to a study in WHO, around 5% of the total world's population, that would be around 430 million people, are currently affected by hearing loss and may be requiring rehabilitation for it. And it is expected in maybe by 2050 that if this continues or if the hearing loss is not treated or diagnosed or proper actions are not taken, people may suffer a little bit more and we may see a large increase in the cases, like there could be 1 in 10 person all affected by hearing loss. So it's very important that we take a good stand regarding the hearing loss programs.
Doctor, what are the common causes of hearing loss?
Okay, to first understand about the causes of hearing loss, we need to know the basic anatomy and how is the sound received by us in our body. So, our ear is divided into 3 parts. One is the external ear, the middle ear and the inner ear. So, the external ear consists of your ear pinna and then we have a tube that is called as the external auditory canal. So, the ear pinna, it collects the sound, it acts like a funnel, it collects the sound and through that tube which I called as external auditory canal, the sound is passed and it hits onto a membrane that is called as eardrum or tympanic membrane. So, the sound waves pass through the tube, it will hit onto the tympanic membrane, and once the tympanic membrane starts vibrating, next we go into the middle ear, that is there are 3 ossicles, that is 3 bones which is joined like a chain. So, from the tympanic membrane to the inner ear, there is a chain of connection of 3 bones. So, those bones begin vibrating and then the sound is transmitted into the inner ear. Inner ear, which consists of your cochlea, labyrinth, and you have a nerve that helps conduct the sound to the brain. So, basically the mechanical vibration that is passed from the ossicles in the middle ear, it passes the mechanical energy and it reaches the inner ear where it is converted into an electrical impulse, and from the inner ear there are small hair cells which move and help the sound reach the brain. Okay. So, now I told you the entire pathway. So, based on that, if at any junction, if there is a problem, like if in the external ear or middle ear or the inner ear, if there is any issue regarding that, we may develop a hearing loss. So, now what are these problems of the different parts of the ear? For example, external ear, now if the outer ear is absent, in some people we may see it is not present or it is small in size, so the sound collection does not happen. Similarly, the tube, the external auditory canal tube, if it is narrow in size or maybe after a injury, accident, it gets closed. So, we call it stenosed ear canal, or if there is wax build up in that tube, then if there is infection like fungal infection or any kind of discharge that is accumulated in the ear, that can cause a blocked or a reduced hearing sensation. Then another portion of your external ear is your tympanic membrane. If there is a perforation or a hole in your eardrum, then again you will have difficulty in hearing. Then next is the middle ear. So, middle ear, there is one more portion in the middle ear that I didn't explain. There is a tube that connects the nose and the ear. So, that tube, if it gets blocked, then there will be fluid collection in the middle ear. So, that fluid collection may cause hearing loss. So, it is very common in children, the ear gets blocked, they may have ear pain and blocked sensation. So, it is related to the tube getting closed. Then another problem of the middle ear would be the bones. So, if the bones are not moving properly, that means they could be stiff, they are not moving, or else there could be a breakage in the chain, that means dislocation of the bones, connection between the bones. So, that can cause hearing loss. Then lastly, I come to the inner ear. So, any maybe trauma to the inner ear, or a continuous exposure to loud sounds or sudden exposure to a loud sound can cause a hearing loss. It could be age related hearing loss. Then certain medicines also can affect the hearing sensation, and certain infections like viral infections like mumps, rubella, they also can cause a sudden hearing loss. So, these are the reasons why a person can present with a ear blocked or a reduced hearing. So, based on that, a treatment plan can be decided.
Okay, now you mentioned about loud noise affecting our ears. Can you make it more clear for us?
Yes. So, as I said, the pathway, the external ear and middle ear conducts the sound into the inner ear. So, in the inner ear, in the cochlea, we have these tiny hair cells which moves with the fluid in the cochlea. So, when the sound vibration is received from the bones in the middle ear, it is set into vibration and we receive the sound vibration into the cochlea. So, the fluid, there is fluid in the cochlea which starts moving, and there are small hair cells that continuously move. So, if there is a sudden loud sound, or if you are continuously exposed to loud sound, what happens is that hair cells continuously are in motion and they get fatigued, they get tired, and so like the person, once they are out of the loud sound, they may feel that the ear has got blocked, or they may feel like there is a ringing sensation, that is tinnitus for some time. So, in some people it is just there for few seconds and it gets recovered once the tiredness or the fatigue of the hair cell is gone. But in some people, if there is a sudden exposure to loud sound, then the hair cell may not recover and the sound may persist, the ear ringing sensation or ear block may persist. So, generally we say a permissible sound for continuous exposure would be anything below 80 decibel. Anything above that continuously could affect the hearing inner ear portion, and similarly any sound of 120 decibel or above, like a gunshot, explosion, or firecrackers, these sounds are generally above 120 decibel, and if suddenly it is heard by a person, they may experience a sudden loss in hearing. So, these are the factors, these are the reasons why loud sounds can maybe affect the hearing.
Okay, doctor, now you spoke about hearing loss. How can we identify hearing loss? Are there any tests to be done?
Yes, there are tests, and most importantly there are things at home that you should pick up. Now, for like in cases of children, if when a child is really small, below 6 months, and if there is a sudden sound like a loud sound and the child is not having a startle reflex, means suddenly getting scared or jerky, that means there could be a problem with the hearing. Then similarly, if when you are speaking to a person and you have to continuously repeat, or the person is asking you to increase the volume, or if you see a person generally listening to a normal volume of the television or radio or mobile and is suddenly increasing day by day the volume, then that means there could be an underlying hearing loss. Similarly, in children, another thing is if there is delay in speech and learning. So it is important that we check for the hearing first, that there is no issue with that, and then we go further.
Okay. Another common query is the common cold will cause nose blocks, and will these nose blocks cause hearing loss?
Yes. So as I told you about the middle ear, so there is this one tube that is present. There are two ends of the tube. So one end is at the back of our nose, at the junction of our nose and throat, that is called as the nasopharynx region, and the other end of the tube is in the middle ear. So that tube is a connection tube between our nasopharynx and the middle ear. So it is very important because it helps maintain the pressure within the ear and outside the ear. So if a person is continuously having allergies or a sinus infection, what happens is the tube, that tube is called as eustachian tube. So that tube may swell up. There will be inflammation in the tube, and the person may eventually develop ear blocks. So it is very common in children like who have history of maybe open mouth breathing, snoring. There is this structure present in the nasopharynx in children called as adenoids, which could be inflamed and blocking the tube and causing the ear blocked sensation or sudden pain in the ear. So it is very important that we identify this problem and treat it at the right time.
Okay. Now, doctor, what are the measures to be taken to protect our ears?
Yes. So to protect our ears, first and foremost, if you are continuously working in a loud sound area, if there is a constant exposure of loud sounds, then what you need to do is you need to use ear plugs or ear muffs to avoid constant exposure to sound. Then other important thing is, do not insert any foreign objects into the ear. It's very common, people feel that there is a itching sensation in the ear or they feel blocked, they immediately use a earbud to clean the ear. That will further cause the wax or any infection that is there to get plugged further inside the ear and cause more problems. So avoid inserting any foreign objects like a earbud, finger, any metallic object, pencils inside the ear. Then always, if your work is always in a noisy environment, it's always better to periodically get your hearing checked. Then if you are experiencing ear pain or ear discharge symptoms, immediately visit or consult a ENT doctor. So these few things would be important. Then if your work is requiring you to use earphones on a regular basis, there are people, maybe children who have online classes or people at centers who need to use for work purposes earphones. So there is a thing called as the 60-60 rule. So use the earphones for 60 minutes at a volume of 60% or lesser. Okay. And after every 60 minutes, try to take a break, so that your ear can be again the inner ear, mainly the air cells, can refresh after the exposure to the sound. So these few things can be taken care of. Then other thing is avoid swimming in maybe dirty waters. So it will protect the ear from any kind of infections. Okay. So when you're going to the beach, or if it's a open pond, try to always cover your ears. You can use these plugs to cover the ear and avoid infections like swimmers' ears.
Yes, yes. Doctor, we find that most of the people complain of vertigo. So, is vertigo and ear balance the same, and is it related to hearing loss?
Okay, that's a very good question, because most of the people think ear balance and vertigo is one, but no, vertigo is basically a symptom of an underlying disease, and ear is one of the causes why you may have a sensation of dizziness or wobbly sensation. So, for understanding vertigo, we need to know what is dizziness and what is our basic balance system. So, now dizziness can be divided into vertigo, disequilibrium, pre-syncope and lightheadedness. So, these are the 4 types of dizziness. So, vertigo is basically a false sense of motion. That means a person feels that his surrounding is spinning or continuously moving, or he feels that he is moving and or spinning continuously. That is vertigo. Now, and then next is disequilibrium. Disequilibrium is when a person feels wobbly or unsteady when he walks. Then comes pre-syncope. Pre-syncope is when you feel you are going to lose consciousness or a sudden blackout, black and blurring, and you fall back. So, that is your pre-syncope. And then there is something called as lightheadedness. Lightheadedness is when you feel that you are losing connection from the surrounding environment, but you are not falling, but you feel that your connection with the things around you is not firm. So, that is your lightheadedness. So, these 4 things come under dizziness. Now, for a person to maintain a steady posture or a good balance, you need few things, that is your ear has to function properly, your brain and your spinal cord has to function properly, then your eyes and your receptors in your hands and leg, your touch sensation, all these things should function properly. So, initially your eyes, your ears and your touch sensations, they all take the information, it is passed on to the brain which processes it, and then the information is carried on to your muscles and joints to perform a function or to maintain a position. If any of these things are affected, then you may feel that you are losing your balance or you may feel unsteady. So, these are the factors that is necessary to maintain a good balance.
So, doctor, vertigo is very common these days. So, is vertigo and ear balance the same, and will it lead to hearing loss?
Yes, it's a very good question. Vertigo and ear balance, that's a very common thing I keep hearing in the OPD. So, vertigo is basically not a disease, it is a symptom of an underlying problem. So, and ear balance, there is no such thing, no disease called as ear balance, but ear conditions, ear diseases can cause vertigo. So, we need to identify that and treat accordingly.
And so, I mean ear balance loss.
Yes, yes, and yes. So, so now what we need to know before going into vertigo, what we need to know is what is dizziness and what is our balance system. So, now dizziness can be categorized into the following types, that is vertigo, disequilibrium, pre-syncope and lightheadedness.
These are the symptoms.
These are the types of dizziness.
Okay.
Yeah. So, dizziness can be of 4 types, you can say. So, one is vertigo comes under dizziness, that would be a person feels that he is it's a false sense of motion where a person feels that the surrounding objects or the surrounding is continuously under motion or spinning, or the person may feel he himself is spinning or in motion. Similarly, next is your disequilibrium, is when a person feels that his gait is unsteady, that means the person may feel that he is little bit wobbly while walking. And next comes pre-syncope. Pre-syncope is when a person feels like they are going to lose consciousness or they feel like there is going to be a blackout. So, the person may feel that they are going to fall back. So, that is pre-syncope. And then comes lightheadedness, when a person doesn't feel that they are having adequate connection with the surrounding. They feel something is off all the time. So these are the types of dizziness. Now for a person to maintain a good posture or a good balance, they need the following things to work together properly. That is the ear, the eyes, the brain and the spinal cord, and the nerves and the skin in the peripheral region, like the nerve endings in your fingers and toes, they have to receive the information properly. So initially the eyes and the ears and your peripheral nerves, they gather the signals, they help it reach the brain, which processes it and transfers the information to your muscles and joints. So if these all together do not work properly, or at any point there is any obstruction, you may feel a sense of imbalance or you may feel dizzy. So it has to be identified and treated accordingly. Now if you ask me what are the causes of dizziness or vertigo, so I would say like it could be related to any ear related problem. The most common would be positional vertigo, that is called as benign paroxysmal positional vertigo, BPPV. So there in what happens is, in the inner ear we have these crystals which should be in a proper position, but due to certain motions like a sudden movement in our head or when we suddenly wake up, the crystals may be placed in a wrong place. So what the person may feel that there is a continuous spinning sensation. So if that is identified, positional tests are there and there are just exercises that can bring those crystals back into the correct position. Then another ear cause that can cause vertigo would be any ear infections, like if a perforated eardrum is infected, so the inner ear can get affected and you may have giddiness. Then similarly, if there is a tumor of the nerve of the ear, that can also cause continuous giddiness, and the patient, when they have these ear infections or a tumor of the inner ear, they may even present with hearing loss or ringing sensation in the ear. So these are common ear problems. Then other problems that could also cause vertigo would be stroke, then cervical spondylitis. If systemic conditions like diabetes, if your sugar levels are not under control, low sugar can also cause, similarly high sugar can cause dizziness. Similarly hypertension, that is blood pressure, if it is extremely high, you may feel a sense of dizziness. Similarly, if your blood pressure is suddenly going low also, you will have that same problem. And anemia, that is a low hemoglobin count, that can cause a sensation of always imbalance for the person. Then hypothyroid conditions or hormonal issues can also cause problems. Similarly, these things should be identified and treated accordingly. Then another very common nowadays is migraine. People do not realize it is migraine because initially one of the symptoms called aura. So the person may feel that everything is blurring out or they feel unsteady constantly. That is one of the first symptoms before they end up getting a severe migraine attack. So that is also another cause of your dizziness. So it's important to identify the underlying cause and treat it. If you identify the cause, then it can be cured and be treated. So then the few things that we need to take care of, like the few things that we have to do to prevent, or like if you are having an episode of vertigo, what you need to do is first stop whatever work you are doing, try to find a place to sit. If you are sleeping and suddenly when you wake up you feel you are dizzy, it's better you go back to lying down and try to identify which portion, which side onto which you are lying is causing more dizziness. So if it is on the left side, then try to lie on the opposite side. Similarly, try to switch off the lights and try to be in a quiet environment. It's very important to stop any kind of activities. If you are like working or maybe driving, try to stop it and take rest, and once you are steady, try to go forward. Then if for elderly people who have a tendency to fall, it's always better to have some light source nearby them, so that they can switch on the light, they can see where they are walking, so that they don't accidentally trip and fall, or maybe they can use a cane to support them and walk in the night time, or when they have to use washroom during their bedtimes. So these few things, and then other thing is like trigger factors is lifestyle modification would be needed, like avoid excessive processed food and caffeinated drinks, because those things can also cause migrainous issues and systemic problems which can cause dizziness. So these trigger objects should be avoided, and certain lifestyle modifications need to be brought in. Then another thing is there is a vestibular rehabilitation exercises. So those exercises will be taught to you by your ENT doctors. So those exercises, once you have been diagnosed with a ear problem or any other cause for vertigo, it's always better you continuously do those exercises, so that your balance system functions properly, because most of the people, they begin getting scared to again walk or maybe do their routine activities once they have the episode of dizziness. So it's very important that you do your vestibular exercise regularly, so that you can train and coordinate each one of your organ properly to maintain a balance.
So doctor, before we wind up, what do you have to say about Al Hilal Healthcare?
Yes, Al Hilal Healthcare is the fastest growing healthcare services in Bahrain, and I am really delighted and happy to be part of this family. So I will be available as your ENT specialist at Manama Central Al Hilal branch, and I will be available for any further queries regarding any of your ENT conditions. Thank you.
So thank you doctor. Thank you once again.
Thank you for having me here once again.
So viewers, as doctor said, hearing loss is an issue that can affect anyone. If you have any hearing loss issue or vertigo, don't panic. Go for medical intervention on time and be happy and healthy always. Till we meet again next time, this is Jasseela Mujeeb signing off. Good night.
All your favorite products under one roof in Bahrain from our 14 branches at 27-year-old Megamart and Macromart. Bakery, fresh meat and fish, fruits and vegetables, sweets and snacks, ready-to-eat foods, dairy products, grocery or consumer goods. To have a wonderful shopping experience, please visit your nearest Megamart Macromart branch. Megamart and Macromart, full of goodness.